Imagine a man who is 71 years old. He is retired, sharp as a tack, and still out there mowing his own grass every single Saturday morning. He still drives himself across town every Tuesday night to play poker with the exact same group of friends he's shared laughs with for 3 decades. Then, his wife finally convinces him to go in for a routine physical exam, one he had been successfully putting off for nearly 2 years. The doctor gives him a thorough look. His blood pressure looks decent, his heart sounds strong, and his weight is perfectly stable. The doctor looks up and says, "Everything seems fine." But then, the doctor adds 6 quiet words that change the entire trajectory of this man's life. Let's just run a few tests. Fast forward 3 months later, that very same man is sitting at home, trying to recover from an invasive medical procedure he never actually needed for a slow-moving condition that never would have caused him a single symptom or shortened his life. Instead, he is now forced to manage painful complications that have absolutely nothing to do with why he walked into that clinic in the first place. And the vibrant, independent life he enjoyed just 90 days ago, the Saturday morning lawn care, the Tuesday poker nights, his complete freedom, that version of his life is entirely gone. What every person over the age of 65 needs to realize is that this specific story is not an isolated incident. It is incredibly common, and it actually has a formal name in medical literature. Today, we are going to have an incredibly honest conversation about it. My name is Dr. Thomas. I specialize in cardiovascular health and aging, focusing specifically on how the human body changes after age 60 and what those changes mean when it comes to making smart medical decisions. Over my years in medicine, I have watched this exact pattern play out over and over again. People who feel absolutely spectacular walk into a routine checkup only to come out the other side trapped in a medical nightmare they didn't have before the screening ever started. There is a specific mechanism behind this pattern. Once you understand exactly how it works, you will never look at a doctor's visit the same way again. Consider this startling statistic. Studies estimate that anywhere from 15 to 25% of all medical procedures performed in the United States every year are completely unnecessary. But here is the critical piece of information that rarely gets discussed openly. That percentage spikes dramatically once you cross the age of 65. This does not happen because older adults are fragile, nor does it happen because doctors are bad people. It happens because after age 65, the mathematical balance between medical risk and actual benefit shifts entirely. The unfortunate reality is that the modern healthcare system rarely gives doctors enough time to explain that complex math during a standard 15-minute appointment. This triggers what medicine calls the cascade effect, and it unfolds like a row of falling dominoes. First, a routine screening picks up a tiny, harmless abnormality. Because that abnormality is now on the record, it triggers a follow-up scan. The scan looks slightly ambiguous, so it recommends a biopsy. The biopsy results lead to an elective procedure. Then that procedure causes an unexpected complication. Suddenly, a senior who walked into the clinic feeling perfectly healthy is spending their days managing a chronic condition created entirely by the medical pathway itself. The cascade never begins with a major surgery. It always starts with that very first, seemingly innocent test designed just to be safe. That is exactly why I wanted to talk to you today. I am going to break down 5 specific medical checkups that I would personally think twice about after age 65. I'm not saying this because medicine is broken, but because the risk versus reward equation fundamentally changes as we age, and very few physicians are discussing this transparently with their patients. We will look at why this balance shifts, explore what has happened to real patients in my practice, and at the very end, I will arm you with 5 powerful questions that will completely transform the conversation at your next doctor's visit. Make sure to stay with me for all 5 of these. Number 3 routinely catches people off guard because it involves a screening that sounds incredibly responsible on the surface. And number 1, the very final one on our list, is a checkup that almost no one thinks to question, despite the fact that the clinical data behind it is more alarming than anything else we will cover today. Before we dive into the details, let me know down in the comments section which city or state you are watching from. I truly love seeing how far this community reaches, and your stories mean the world to me. But before we look at the list, you have to grasp one foundational concept. Without understanding this piece, the rest of this information won't fully connect. I call this concept the longevity lens. When you are 50 years old, routine medical screenings can be absolute lifesavers. If you detect a dangerous issue early and treat it immediately, you are potentially buying yourself another 20 or 30 years of vibrant health. In middle age, the mathematical investment makes perfect sense. However, once you pass 65, three major factors flip that equation on its head. First, many of the minor conditions discovered through routine screenings in older adults are completely harmless. They grow so slowly and produce so few symptoms that, realistically, you will live out your natural lifespan without them ever bothersome you. But once an abnormality is printed on a lab report, the medical system rarely has a button that says, "Leave it alone." It has a treatment button, and that button almost always gets pushed. Second, your body's ability to tolerate medical interventions changes as the decades pass. An operation that a healthy 55-year-old can bounce back from in a couple of weeks might require many months of grueling rehabilitation for a 74-year-old. Sometimes it leads to a permanent loss of independence or chronic side effects that never truly go away. Third, you have the cascade effect we just talked about. That single test finding a minor glitch that sets off a massive chain reaction, destroying a baseline of health that felt perfectly fine to begin with. I want you to view every single item on our list through this longevity lens. Because once you begin looking at healthcare through this perspective, you will start asking entirely different questions. That brings us directly to checkup number 5, routine PSA testing for prostate cancer in low-risk men over the age of 70 who show absolutely no symptoms. Let me clarify my position immediately. I am certainly not suggesting that prostate cancer isn't a serious disease, nor am I saying that PSA testing has no place in medicine. What I'm pointing out is that for men over 70 who feel great, have no family history of the disease, and have no prior urological concerns, the scientific data reveals a reality that is vastly different from what most men hear in the examination room. Here's the core dilemma. A PSA blood test can easily detect a form of prostate cancer that is biologically so slow-moving that it would never cause a single health issue. It is a tiny tumor that would never spread, never cause pain, and never take a day off a man's life. He would ultimately die with it, not from it. But the moment that elevated PSA number pops up on a screen, the machinery of modern medicine kicks into high gear. Biopsies get booked, specialists enter the picture, and intense discussions about intervention begin. For a vibrant 71-year-old, those interventions can include radiation, aggressive hormone therapies, or major surgery, all of which carry steep risks that can permanently damage bladder control, sexual function, energy levels, and overall quality of life. In fact, organizations like the American Cancer Society updated their official guidance for this exact reason. For older men at average risk with zero symptoms, the physical and emotional toll of hunting down and treating these sluggish cancers routinely outweighs any potential benefit. To show you exactly how this looks in the real world, let me tell you the story of a patient named Raymond. Raymond was 74 years old, a retired electrician living out in Tulsa, Oklahoma. He was the kind of guy who stayed constantly active, still scaling ladders to clear his own gutters even though his wife absolutely hated when he did it. He had no family history of prostate problems, zero urinary issues, and felt completely fine. But during his yearly checkup, his PSA test came back just slightly elevated. It wasn't an astronomical number, but it was just high enough to automatically trigger the next step in the clinical protocol. A follow-up biopsy confirmed a low-grade prostate cancer with a Gleason score of 6. In the medical world, that is about as sluggish and slow-moving as a tumor can possibly get. The problem is, the second the word cancer enters a room, logic gets pushed aside by intense emotion. Raymond trusted the system and followed the recommendations, enduring a full course of radiation treatment. 8 months later, the vibrant man who used to climb ladders was gone. He was constantly exhausted, his daily schedule was completely dictated by sudden urinary urgency, and his baseline energy had vanished. The incredible quality of life he used to enjoy was utterly disrupted. When he eventually sat down in my office and recounted his journey, he said something to me that I will never forget. "I felt a whole lot better before they found it than I do now that they've fixed it." That exact sentiment echoes through medical journals far more often than the public realizes. So how should you actually handle this? If you are experiencing real symptoms like hesitation, a weak stream, or having to wake up multiple times throughout the night to use the restroom, absolutely speak up. Those symptoms matter. And if your family tree is full of prostate cancer, that completely alters the baseline math. But if you are over 70, completely symptom-free, and carry an average risk profile, your conversation with your doctor shouldn't just be a passive agreement to a test. You need to look them in the eye and ask, What exactly happens if this test finds something? And will treating a microscopic issue actually improve the quality of my daily life? Asking those two questions alone will profoundly change the choices you make. That brings us to checkup number 4. Routine bone density screenings that lead to an automatic, lifelong pipeline of medication. I want to be incredibly precise here. Osteoporosis is a very real condition, and falls can be absolutely catastrophic for older adults. But there is a massive difference between evaluating your bone health and blindly entering a pharmaceutical conveyor belt that is incredibly difficult to step off of. Doctors use a DEXA scan to measure bone thickness. If that scan reveals thinning bones, patients are routinely started on a class of drugs called bisphosphonates. You have likely seen the commercials for medications like Fosamax, Beniva, or Actonel. The logic presented to patients sounds entirely straightforward. Thin bones mean fractures, and these pills mean protection. What the standard conversation completely leaves out, however, are the long-term dangers of staying on these drugs, especially past the 5-year mark. Over extended periods, bisphosphonate use has been linked to a rare but highly destructive condition known as atypical femoral fractures. Essentially, it causes spontaneous stress fractures in the thigh bone, the single thickest, strongest bone the medication was supposed to be protecting in the first place. There's also a risk of osteonecrosis of the jaw, which is a painful breakdown of the jawbone that is notoriously difficult to heal. Meanwhile, the data shows that the single most effective way to prevent fractures after age 65 has absolutely nothing to do with a prescription bottle. It is preventing the fall from happening in the first place. We're talking about proactive balance training, targeted leg strength exercises, clearing tripping hazards from the home, getting regular vision checks, and auditing your medications to make sure none of them cause dizziness. In fact, clinical trials focusing on Tai Chi have shown a near 50% reduction in fall risks for seniors. And unlike a long-term pill, practicing balance exercises doesn't come with a laundry list of procedural side effects. Take the case of Gloria, a 72-year-old retired elementary school teacher from Phoenix. She had a routine DEXA scan during her annual physical. Her doctor noted low bone density, and she was immediately put on medication. 3 years into her treatment, Gloria started experiencing a deep, severe ache in her thigh. It turned out to be the early stages of an atypical stress fracture. She had never fallen, and she had never broken a bone in her entire life. Her body was actively reacting to the very drug meant to safeguard her skeleton. This is why every older adult needs to ask their provider, what is my actual real-world fracture risk based on my entire health profile, rather than just a single scan result? And how does taking this medication compare to putting me in a structured, proactive fall prevention program? A truly great doctor will welcome that dialogue. Now let's tackle checkup number 3, routine cardiac stress testing when you have absolutely no symptoms. This one catches almost everyone off guard because it sounds like the pinnacle of responsible healthcare. You are 68 years old, and your physician casually says, let's just put you through a stress test to make sure that heart of yours looks good. So you hop on a treadmill, or they use a chemical agent to mimic exercise while monitoring your cardiac blood flow. It feels entirely benign, but here's what is rarely explained before you sign the consent form. In patients who display absolutely no symptoms, meaning no chest pain, no unexplained shortness of breath, and no dizziness when exerting themselves, cardiac stress tests have a false positive rate that approaches a staggering 40%. That means nearly 4 out of 10 tests will flag a dangerous issue that does not actually exist. Once an abnormal result is stamped onto your chart, a doctor cannot simply look the other way. The standard protocol dictates that you move to the next level, a cardiac catheterization. This is an invasive procedure where a tube is threaded through your blood vessels directly into the chambers of your heart. That procedure carries its own set of dangers, including severe bleeding, arrhythmias, and direct blood vessel damage. In tragic, rare instances, the catheterization process itself can actually trigger the exact heart attack the screening was originally trying to prevent. And what happens if they do find a blockage? Finding arterial plaque is incredibly common once you pass 65. If they see it, a stent is usually inserted. Here is the monumental piece of data you need to know. Massive clinical trials, including the landmark ischemia trial, discovered that for stable coronary artery disease, inserting a stent frequently did not lower the risk of future heart attacks or extend a patient's life any better than optimal medication and standard lifestyle adjustments alone. In short, thousands of people take on the immediate invasive risks of a procedure without gaining any meaningful improvement in how long or how well they live. There is that cascade effect once again. You feel perfectly fine. You agree to a routine stress test. You get a false positive. You end up on a catheterization table. You get a stent. And suddenly you are on lifelong blood thinners and constant monitoring. A massive medical detour, all because someone said, let's just check. If this perspective is opening your eyes and making sense so far, do me a quick favor and type the number 3 down in the comments. I deeply appreciate seeing who is still locked in with me, and it truly helps this vital information break through the noise so it can reach the people who need it most. So what exactly should you shift your energy toward instead of chasing routine cardiac stress tests? The true lasting health gains after age 65 come from aggressively managing your actual cardiovascular risk factors. We're talking about keeping a close eye on your blood pressure, tracking your blood sugar levels, monitoring your cholesterol, staying physically active every single day, and prioritizing high-quality sleep. These foundational habits are what consistently move the needle towards superior heart health, not signing up for yet another invasive procedure. That brings us directly to checkup number 2, routine carotid artery ultrasounds in people showing absolutely no symptoms. Almost nobody in mainstream medicine talks about this one, and honestly, that silence is deeply concerning. A carotid ultrasound is a quick scan that checks the major blood vessels in your neck that supply oxygen to your brain. On the surface, the logic sounds flawless. Find any narrowing or plaque buildup before it causes a stroke, fix it early, and prevent a disaster. But the real-world application is far more complicated. The surgery commonly used to clear out that narrowing, called a carotid endarterectomy, carries its own inherent stroke risk, averaging around 2 to 3% in major clinical studies. If you are an older adult managing other underlying health conditions, that procedural risk climbs even higher. Because of this, the United States Preventive Services Task Force specifically recommends against routine carotid screening for adults without symptoms. Why? Because in an asymptomatic person, the dangers of the intervention routinely outweigh the potential rewards. A massive percentage of adults over 65 naturally have some degree of arterial narrowing. More often than not, it is completely stable, entirely harmless, and has been sitting there for years without causing a single issue. But the moment a routine screening shines a light on it, a surgeon may feel compelled to recommend fixing it. During that very operation, a piece of that stable plaque can break loose, travel straight to the brain, and trigger the exact stroke the procedure was supposed to prevent. That is the dark side of the equation patients rarely hear about. If you want to focus on what actually matters most for stroke prevention after 65, it comes down to strict blood pressure control, managing your blood sugar, properly treating atrial fibrillation if you have it, and maintaining regular physical activity. These targeted interventions consistently outperform unnecessary surgeries in healthy adults. Now, if you are actively experiencing symptoms, such as sudden vision changes, facial drooping, weakness in your arm, brief moments of confusion, or slurred speech, that is a completely different story. That is no longer a routine screening. That is your body sending an urgent distress signal, and you need to get evaluated at an emergency room immediately. Finally, we arrive at number 1 on our list. The checkup that almost no one thinks to question, routine colonoscopies after age 75 in low-risk, symptom-free adults. This one catches people completely off guard because colonoscopies have been heavily promoted for decades as a gold standard of preventive medicine. And to be completely fair, for adults earlier in life, they absolutely can be lifesavers. But once you cross the age of 75, the mathematical equation shifts dramatically. In fact, the United States Preventive Services Task Force explicitly advises against routine colonoscopy screening for average-risk adults over 75, simply because the procedural risks begin to dwarf the potential rewards. Those risks become incredibly vivid when you look at the actual complication rates. Take colon perforation, a literal tear in the bowel wall. This happens in roughly 1 out of every 500 colonoscopies. In a younger adult, a perforation is a serious complication, but it's manageable. In a 77-year-old, that same tear can mean emergency surgery, waking up with a colostomy bag, a massive hospital stay, and a permanent loss of independence. And we haven't even talked about the dreaded bowel prep yet. The aggressive laxative fluid required before the procedure can severely dehydrate an older adult, completely disrupting their electrolyte balance, straining the heart, and taxing the kidneys. On top of that, sedation risks rise significantly with every passing decade. Then we have to look through our longevity lens once again. Many colon cancers discovered through routine screenings after age 75 grow at an incredibly sluggish pace. often slowly enough that they would never impact a person's remaining natural lifespan. Consider the story of Margaret, a 78-year-old retired schoolteacher from rural Ohio. She'd already undergone 2 completely clean colonoscopies earlier in life, had 0 family history of colon cancer, and wasn't experiencing a single symptom. But during a routine checkup, a new doctor noted she was due for another scan based purely on the calendar. Margaret hesitated and asked a few questions, but after being reassured it was just standard practice, she agreed to schedule it. The intense bowel prep hit her system like a freight train. By the next morning, she was profoundly weak, confused, and could barely stand on her own 2 feet. Her daughter skipped the clinic appointment and rushed her straight to the emergency room instead. Margaret's electrolytes had plummeted to dangerously low levels, and her heart was under severe strain from acute dehydration. She ended up spending 5 days in a hospital bed recovering, and she never even had the actual colonoscopy. Later, when she was reflecting on the ordeal, she told me something that perfectly encapsulates this entire issue. "I felt a whole lot healthier when I was overdue for the test than I did after trying to take it." That sentence has always stuck with me because it highlights the core dilemma of modern senior healthcare. Sometimes the medical intervention becomes infinitely more dangerous than the condition you are hunting for. So what is the smarter alternative? If screening is appropriate, look into non-invasive stool-based options, like an annual FIT test or Cologuard. These methods can flag potential warning signs without exposing an older adult to the structural and chemical risks of an invasive colonoscopy. And as always, if real symptoms are present, like blood in your stool, unexplained changes in your bowel habits, or persistent abdominal pain, that changes the entire playbook. Symptoms always demand a thorough medical evaluation, no matter your age. But screening a perfectly healthy, symptom-free adult after age 75 deserves a much more nuanced, transparent conversation than the one most families are currently getting. Now let's dive into the practical, actionable part of this discussion. After all, having information without taking action won't protect anyone.